biomedical and pharma manufacturing hubs that pioneered the production actually of hepatitis generics in Egypt. 4D, BioNovac, probably comes to you as something really exciting, maybe even a dream come true, if I may say so. How can the value chain accelerator benefit from Pharco and vice versa?
It's really a dream, and we hope it will do something great, because by the year 2033, no free lunch anymore, no waivers for patents. And the prices for medicine now is so high. The price for the medicine for hepatitis C started with $100,000 per patient. But luckily, when we succeeded in transforming the 4Ds, which are drugs, diagnostics, doctors, and dorms, to 14Ds with direction and political will, discoveries, data management, documentation, and accreditation, where we had 4 WHO pre-qualifications, in getting the price down from $100,000 to $60 per person. And this will help in the SDG 2030 in noticing and diagnosing and curing 90% of the hepatitis patients in the world. By COVID, the first year, 2 million people passed away. Yet by hepatitis B and C, 1.5 million person dies every year. But by COVID, they die in 10 days. By hepatitis, they die in 10 years. So nobody is taking care of this. How can we get use of the Egyptian ecosystem? What we did, the Ministry of Health in Egypt is ready to spider out the management system for combating hepatitis in Africa. This is something great. Second thing, in 2005, we succeeded in curing schistosoma by an African product in Egypt. In 2015 to 2020, we cured hepatitis in Egypt by curing 4.1 million patients in a few years. Now we are having a very big threat, which is cancer. Research. No free lunch, and if you don't look, you won't see. We are happy to work with the African Academy for Science, where we made from an African product something for cancer. By the year 2018, the diabetes market worldwide was $47 billion. By the year 2024, it's going to be 57 billion. Yet by cancer, it was 110 billion. It's going to be 230 billion with 120 billion increase. So how can we cure Africans? Drugs for the have-nots. How can Pharco be a hub or a technology transfer system for the African countries that they want to build something? Economies of scale. How can we supply champagne on beer's budget? If we need, in the coming 10 years, 10 manufacturing facilities in 10 African countries, one tender could be made for the whole of the machinery. We can make API together. So, luckily, we got chosen by the WHO for the mRNA technology transfer for vaccines and other new biotech drugs. So I think Egyptian Ministry of Health and Pharco could be a big supporter for doing something great for Africa. Thank you very much, and happy African Day.
Thank you very much for what you said. I heard champagne, I heard no free lunch. I'm just joking. Egypt really has done some truly outstanding work, particularly in the space of mRNA technology. And we really look forward to learning and for all the collaborative elements that you have described. I would like to invite Dr. Juliette Ehimwan, the